on this. Good evening, and it's lovely to welcome Shahid Bukhari, who's going to talk to us this evening about traditional Unani Tibb medicine. He is an accomplished practitioner, a homeopath, acupuncturist, herbalist, master iridologist, and naturopath. And he has, for 6 years now, been building a college teaching Unani Tibb medicine. So I'm going to pass you over straight away to Shahid, who is going to give a presentation on this.
Great. Thank you, Roger. Thank you for this opportunity to explain a little bit about Unani medicine. I'm going to share you my slides. Can you see the slides?
Yes.
Okay, fantastic. Okay, right. So as you said, I'm a practitioner of Unani medicine, and I also teach this Unani, like a diploma level Unani course, 3-year diploma. And so what I'm going to go through is explain a little bit what Unani medicine is and its relevance, and some of the sort of the basic concepts of Unani medicine. So, okay, so interestingly enough, the word Unani actually is the Arabic word for Greece or Greeks, in effect. So these islands I think there's 7 islands called Ions, and the Arabic word for iron, they couldn't pronounce it, so they started saying Yunan as opposed to Ana. I'm assuming that was the original pronunciation, and that's how the word Unani comes from, which really literally means Greek medicine. So there's a reason why it's called Greek medicine, because a lot of the main philosophy of Unani medicine is Greek philosophy and Hippocrates and the like. So, and the history is actually even more ancient than Greece. The medicine actually predates Greek philosophy. The Greeks studied with the Egyptians and also other influences, and then they developed what is known as the Greek philosophy and medicine, which it was, in effect, this is the main medicine other than the Chinese system of medicine and the Indian system of medicine. This was the medicine that was practiced throughout the rest of the world, in effect. And after the Greeks, the next sort of things kind of like went a bit sort of quiet for a little while, and then the next sort of superpower empire was the Arabic Empire, and they translated a lot of the works from Greek and other sources into their own language, Arabic, and then it was further developed over time. So that's just like a quick explanation. So as you can see, it has also links with Egyptian medicine. As I said, the Greeks studied under the Egyptians, and and this is Hippocrates, sort of the impression of Hippocrates. And Hippocrates essentially was known as the father of medicine, father of what they call father of Greek medicine. And then later on it was developed by the Roman, or actually Greek, physician called Galen. I think a lot of people have heard of Galen, or Hippocrates also. And so essentially this system works on what we call the 4 humors, or the 4 temperaments and the 4 elements. And also it was, as I said, it was developed up until a point by the Arabs as well, who then came up with a lot of additional theories like distillation. A lot of the word chemistry is Arabic, so it comes from this system of medicine. And then this medicine was practiced in Europe also up until about the 15th, 16th century. And it's in effect the basis of modern medicine as well, where we split off at around about 300-400 years ago. And as I say, it was developed over time under the further developed by the Arabs, or the Arabic. It wasn't just the Arabs, but it was the Arab Empire, in effect. And then famous physicians through that period was Ibn Sina or Avicenna. And he developed, as I say, a lot of the sort of methods in anatomy, chemistry, pharmacology. This would be about 1,000 years ago, and we still use his works in Unani medicine. We still use a lot of the fundamental concepts. And even Europe as well. This is Culpeper, and he also practiced this system of medicine in the 16th century. He died pretty young, actually. He was 37, I think he died. And so it's also, interestingly, it's part of European tradition, this medicine. So it's not alien. And even some of the terms and the language used in from Unani medicine or Greek medicine is part of the English language. Like somebody's choleric or melancholic or sanguine, and you find those terms, within the English language, and even phrases within, literature of Shakespeare and things like that. So essentially, what the system is, it's based on concept of elements, as I said, temperaments, humors, organs, what we call the vital force, the faculty, and functions. Those are the main principles of Unani medicine. And so we have something called the constitution, which maintains the balance within the system of the human body. And so in terms of those, we talk about in a very basic level, like in Chinese medicine, they have yin and yang. We have the four properties, which are hot, cold, moist, and dry. And from those, we make the elements and the temperaments. So whether within ourselves or within food or the environment or the seasons, we divide everything into those four basic concepts. So something can be hot, something can be cold, dry, or moist, or there's a combination of those things. And from those, you can make the four temperaments. So the four temperaments, so for example, ideally, summer should be hot and dry, and spring should be warm and moist. And so within the seasons, where the individuals are divided, as I say, with food and exercise, and everything is divided into those. How that's relevant is, so, for example, if you say, bananas are good for you. So for a Unani physician, that's not enough. He needs to know the temperament of that food. Is that food appropriate for that particular person? So if the person is phlegmatic, we wouldn't necessarily prescribe bananas because that would increase their phlegm. Yeah. So similarly, milk, for example, milk is, real milk is good for you. It's supposed to be for most people, but not the way it's produced now. But say milk, if you consume milk, that's going to increase your phlegm. But for somebody who is hot and dry, milk is good for them. Real milk is good for them. So that's how we divide things. And similarly with exercise, which exercise is appropriate for which temperament. And from more on a sort of medical level, something like a headache, it's we have to first understand what type of headache is it. Is it a hot headache? Is it a cold headache? For a Unani physician, there's 25 different types of headaches. So we have to understand which type. So we would treat, if you give the same medicine to somebody who has a hot headache or a cold headache, you're going to make them worse. Yeah. So most of these, for example, a lot of the pharmaceutical medicines, they are what we would normally term them as cold medicines. They will aggravate somebody who already has a cold headache, for example. Okay. Right. So So other than the elements, the four elements, yeah, which we four elements being earth, water, air, and fire. Those elements are a way to describe those four those properties that I described earlier. And we have the temperaments, and we have something called the humors. The humors, in effect, are what we consume from food, and that's what's converted into these humor qualities, which are the fluid types within the body. And the reason why that's important is that you could have an imbalance in a particular humor, in either the blood humor or the phlegm humor or the yellow bile humor. So if there's an imbalance, we believe that that causes a disease. Yeah. So, for example, arthritis, rheumatoid arthritis, for example, that for us means there's an increase in phlegm. So Unani physician would give certain prescriptions where the prescriptions could be diet related, prescriptions could be exercise related, prescriptions could be, a certain herb to reduce or remove that phlegms from the joints. Yeah, for example. Yeah. So I was giving this a quote from Shakespeare, how some of the terminology, some of those words are within part of the English language. So it's not alien, it's not yin or yang, or which is not part of the English language, or pitta or pit from the Ayurveda system. Right. So what a Unani physician believes is that the body's innate, body has this quality that it actually heals. So it's not the physician that heals, it's the body that heals. And this is not, obviously, it's probably teaching grammar to suck eggs here, because all of us understand that, you don't have to be a physician or naturopaths understand that it's really what's within you is what heals you. The Unani physician or the naturopath would always be only there to facilitate the healing process. That's our job, really. So if you cut your finger and you put something on like a tape or a bandage or something, and then it's not the bandage that heals you, it's your body that heals you. See, so that we're never there to subdue the vital force. We're there to facilitate. The physician is always there to facilitate the healing process, just sufficiently for the body to take over. Yeah. So another thing is that something called the 6 essential factors. Unani physician believes that all illnesses are caused by 6 external factors, and those external factors are cause an imbalance in the system, which causes a disease. So these 6 factors are air, meaning the environment, the air, food and drink, physical movement and rest, mental work and rest, sleep and wakefulness, retention and excretion. So meaning that, for example, food. Are you eating too much food, too little food? Are you eating the food at the wrong time? Are you eating food inappropriate for your age, for your mizaj, for your temperament? So that's the thing. And another example would be, say, sleep. Are you getting, say, a choleric person only needs 6 hours sleep. A phlegmatic person needs 8 hours sleep, right? Now, if they're getting too much sleep, there's a problem. It creates coldness. If they're getting too little sleep, it creates dryness. So that's when they come and see you, because there is an issue. Okay, so that's why and retention. So retention could be, you go to the bathroom every day. Are you going to the bathroom too much? Yeah, and it's not just that. It could be sweat as well. It could be other things. So we look to that, to balance those, and when we investigate, we find out where the imbalance is. So we always need to know the cause. We don't treat anybody until we understand, in most cases, until we understand what the cause is. That's crucial for, we don't just go in their feet first and say, oh, hey, you take this, you got a headache, take this take, this medicine, or, take lavender or something like that. But we need to see not only the temperament, but what's causing it. Yeah. Otherwise, you just become like a pharmacist or something like that. You're not really handling the cause, because the person will get better, but then will come back again because you haven't really identified the cause. So identify, like diagnosis, well, how do we diagnose? Okay, we diagnose by certain signs that the client presents, and then from there we work out what the imbalance is. Okay, we read the pulse, we ask certain questions, we observe, and from there we can work out what's going on. Okay, so for example, here the sign of an abnormal hot temperament. So person could be naturally, for example, hot. Fine, they're hot and dry because they're choleric. Okay, something has caused an imbalance and they become more hot and dry. So then these are the symptoms they will present. They'll say, oh, invariably they say, oh, we have a bitter taste in the morning. We get up in the morning and we have a bitter taste. Okay, and the pulse seems, when you check the pulse, is weak or fast. Yeah, they don't like eating hot things. So similarly, with an abnormal cold temperament, there is a lack of digestion. They don't feel thirsty. They feel better from hot food. That's how we know there's an abnormal cold temperament. For the wet temperament, it'll be similar to cold, but additionally there'll be more saliva, more mucus, the excessive sleep. I mean, generally speaking, a phlegmatic person would love to sleep. They like sleep. Okay, so they want, they got the alarm clock on, and they'll say 5 more minutes, 5 more minutes, 5 more minutes. Yeah, but in this case, this person is not well, so it's becoming excessive. Okay, and there are puffy eyelids, and for the abnormal dry temperament, they would have dry skin, insomnia, adversity from dry foods, abnormal weight loss, for example. They might not have all the symptoms, but these are the main ones. So, as I said before, we need to know the cause, the disease, and the after effects. And as I said to you before, we do the physical examination, we have systematic questioning, and so examination and questioning. And the things we look for, we determine the factors like the complexion, the build, the touch, the hair, movement, diet, the sleep, how they're affected by weather, the pulse, emotions. And the type of treatments we offered, I briefly mentioned them, but we can have regimental therapy. That could be exercise, that could be a sauna bath, it could be, a hammam, we call hammam. It could be diet change. Mainly, I would say probably 50% of the clients, I just change the diet. It could be some herbs. I've said surgery, but we don't do any surgery. Surgery here means like hijama or something like that. We do some bloodletting, but we can't do that much in this country. We're restricted. So as I said, the preferred lines of treatment, regimen therapy is usually preferred because it eliminates the risk of harming the body. E.g., for example, weight gain. First, we obviously recommend exercise, reduce the diet, change of diet, some natural drugs, and maybe some sort of treatment. Exercise, massage, fomentations, vomiting, purging, enemas, those are commonly used. Diet could be, fasting, restriction of certain foods. If they're, on the other hand, it doesn't have so much now, but they could be underweight as well. So you might want to change the diet accordingly. A lot of people sort of go for the weight loss, but they're eating, they look thin, but they're really unwell. So for example, food types, I would give an example. For a phlegmatic or sanguine person, we tend to give them more hot and moist foods, will aggravate them, sorry. and they should be eating more cooling and drying foods because they're already hot and moist. Yeah, too much hot or damp foods will have a detrimental effect on their health. So most of the pharmaceutical, most of the drugs are tend to be herbal. There could be some animal, and rarely some animal sources. And so we prefer single drugs. We don't like using compound, but there are a lot of complex formulations as well. So we have a list of pharmaceutical, so herbal medicine. We got the teas, we got something called majuns, which are honey-based. We got khamirs, which are sugar-based. We powder the herbs and put them into a sugar base. We get these other sources like powders, tablets, pills, syrups, vinegars, oils. Sometimes people don't want to take anything inside, so we might give them a scent. Certain scents have effect, like rose, for example. We may put some rose. They can smell rose, or they put some rose on near the ear. That really helps calming people with anxiety, for example. We use distillations as well. Yeah. So yeah, the other therapies like hijama, cupping. It is very effective in removing dead blood cells, clears blockages, stagnation, etc. I think most people are familiar with cupping and hijama. So that's my slides. As a very quick rush through what I was talking about, but I want to discuss, but I wanted to keep it within half an hour. So hope that it's a quick rush through. I hope I didn't bore you too much, I think.
You didn't. Thank you very much, Shahid. Interesting. I was quite fascinated to hear that it sort of revolved around Greece earlier. But I know from my teachings that the Physician's Tomb in Saqqara has a lot of depictions of various therapies there.
Yes.
And I'm also well aware of Ibn Sina, or Avicenna as he was called in the West, who developed a lot of surgical techniques which are still used now.
Absolutely.
And it's a great shame that that sort of respect and knowledge has been forgotten by the West.
Yes.
The
Well, that's true.
the society in the Arab world was very advanced at that time, much more advanced than the European one.
Yes. But in many ways, the point I'm trying to put across was that it's European legacy as well.
Absolutely, absolutely. It all melded into one, really, didn't it?
Yeah.
Yeah.
So I mean, the Arabic world sort of developed it further, and then sort of, as I say, for the last 300 years, nothing really, because it's run all into sort of what we call Western medicine, or eventually pharmaceutical medicine.
Yes, indeed. Yeah.
About how many Unani therapists are there in the UK, would you say?
I'm not sure the numbers, but there are quite a few. So what happened was a little bit of the history is that it was practiced. So as I say, it was practiced in the Arab world, and then it sort of like then it also moved eventually into sort of India and places like that, and then it was promoted in India and Iran, those countries, and Turkey, less so in the Arab world for the last few hundred years. But then when colonial powers came in, and most of that was sort of like suppressed, and then so one of the things was that it wasn't really taught anymore in universities and schools for the previous 200 years or so, and then people then taught it more like father to son became, and more of an apprenticeship as opposed to going to university and studying it. And then when there was an independence movement in this country, say in particular, like for example Gandhi and people like that, they said that like we need to bring back our own traditions. So when the independence happened in the subcontinent in 47, all those countries, they funded these universities. So there are about a number of universities in India and Pakistan, Bangladesh, and Sri Lanka, which teach this as like a 6-year degree program where you become a doctor of Unani medicine. Okay, there is still the apprenticeship stuff going around, but so in order to also say they are the same thing with Ayurveda and the same thing with homeopathy, even though homeopathy is not indigenous, but it's still promoted over there as a full 6-year program. And the physicians over here in the UK, there are a number of them. I don't know the numbers, but probably a few hundred, I would say, if that.
When a patient attends a consultation with you, do you tend to apply all of the different modalities that you have, depending on what seems to be necessary? Or are you very strict in saying, well, this is an Unani consultation and another time it'll be a herbal or an acupuncture consultation? Sure. I mean, how do you tend to sort of personally approach a patient?
Sure, yeah. Obviously, I've trained, in iridology as well, and I've also trained with Roger as well. So and with TCM as well. So I tend to primarily sort of treat people through a Unani system, but a lot of people come to me through iridology, and they want the iridology done as well. Yeah, even though iridology is not part of Unani, I've made it part of my Unani, and also I teach that as like when I teach the course, I have two modules where I teach iridology, because I think iridology is like amazing, and it kind of helps a lot for my clients. Just love to see iridology. Yeah, so the interesting thing is that when I read the pulse, for example, they don't know what I'm reading. But when I do take iridology or show them what I'm seeing in iridology, I can show them what I'm seeing, right, at the same time, and that they love that aspect of it. So what happens is that I do a combination. So I mix iridology with the Unani aspect of it, in particular, and then the interesting thing is the pulse tells me what's going on at this very moment. The iridology tells me the genetic composition of what's, so that gives me like a both in a way. And then like I just had a patient sort of a couple of days ago, and they had an issue with the vision, and the vision was going down. They went to the optician and the doctors, and they didn't know why the vision was not, there wasn't it was getting deteriorating, basically. It was like a little foggy. So there is a Unani prescription for that, which is very effective. So I gave her that, but that takes couple of months to get better. It's a slow process. So I did an acupuncture point on them on the feet, and they almost immediately found a benefit. Within 2 or 3 days, the vision improved.
Fantastic.
Right. So I do a combination. I know it's a long-winded answer to your question.
Yeah, but it doesn't need to be pure then. I mean, when you teach your students, are you saying to them, you've got to tell the patient this is Unani and this is not? It's not like that. They can combine.
Well, thing is, I think we should. Because I think there is each tradition has a beauty in it. So sometimes I even use Ayurveda, even though Ayurveda, I haven't studied Ayurveda, but some herbs I take from Ayurveda, which are really effective, like Kanchana Gugu. It's really amazing for many sort of like things like PCOS, right? And I will use other things if I feel is needed. I primarily use Unani, but if needed, I will definitely use that.
It's a good naturopathic tradition, that is, actually, because, of course, naturopaths is a philosophy, and the philosophy behind Unani and naturopathy is very much the same, is that we have this self-healing mechanism. The body heals itself, and anything can be employed, really, by a naturopath to promote equilibrium.
Yes.
And I was very interested to hear you say that most people, 50% of people you use diet with, because I must admit, I tend always to go in my consultations with the gentlest acting way that you can start to get a healing process. If that isn't strong enough, then you can always resort to other modalities.
Yes, absolutely. And I agree 100%. First of all, the answer to the first part is that the patients come first, not necessarily the tradition, okay, or the clients. We're supposed to say clients, but the clients come first. All right, it doesn't matter, whatever helps them with, we need to get them better. Okay, it's not, and that's our ethos, in effect, I would say. And then the second point you said was Unani physician, and I'm sure all of us will agree that we use the minimum amount. We don't like intervening with herbs. We just do not like doing that. We say the body needs to heal itself, and then sometimes you guys know this, that sometimes a good word even helps them. Give them nothing. So I've people have come to me and the stuff so by the time they come to me, they've been to the doctor, the physician, even dietitian, they've been to everybody, and then we're less known, you see. So by the time they come to me, their shoulders are slumped and they're like sitting like this, and you're like the last hope, so to speak. And I heard that you help some person, and so you say, even if you say to them, "Don't worry, you'll be fine," and they feel happy. You says you're the first person who said that, right? And sometimes even that's a form of healing.
Yes, indeed.
Yes. One thing you mentioned was that most people will know what hijama is and cupping,
Yes.
but I suspect that a lot of people watching this will not be therapists, because it will be on our Open GNC site. Maybe you could say just a few words about that, because you didn't really cover it, yet it sounded so fascinating.
Sure. Okay, sure. So cupping or hijama. So cupping is practiced, it's a very ancient tradition, and it's practiced by the Chinese and also by other traditions. And so what you do is you place a cup, and it could be different forms. It used to be a bamboo cup, or it could be a glass cup, or whatever. Different types of porcelain ones. They tried different over time. They used to use a horn as well, so they would suck the air out of it. I used to place a vacuum, create a vacuum on a different parts of the body, and then you can leave it there for a few minutes. Really, the action happens within the first 5 minutes. You don't really need to leave it for that long, but people leave it for a bit longer. And so what in the difference between cupping and hijama is, in cupping we just leave the cup and we remove it after a certain amount of time, 5 to 10 minutes or so. But with hijama, you then go back and make some incisions, right? And then you put a cup back on again, and that sucks that blood out from there. Okay. The idea behind it is that it creates a flow of blood. We believe in stagnation. Stagnation is bad, whether you're the TCM practitioner or Unani practitioner. Stagnation is illness. So we need to move things. So by moving the surface blood, the idea is that the pressure further down is relieved. Okay, and so that helps in many things, like pain, particularly in pain. That's the main one. Okay, but it helps with energy levels, fatigue, and so forth. And fertility, we use it for fertility as well.
Oh, my goodness.
Fertility points. We use it for people having difficulty sleeping and things like that.
Thank you.
Great. Perhaps we should have a talk by Rizwan Suleiman on ICAT's view of hijama, which is the wet cupping. Yeah,
that would be fascinating as well. Yes.
Good.
But you did mention that isn't permitted in this country to a vast extent. Is that because only certain practitioners can apply that?
Sure. So that's hijama cupping. There's something else called fusset. So there's a difference. So there's cupping, and hijama. Hijama is wet cupping, and then there is something called fusset. Fusset is bloodletting.
Oh, I see.
That was practiced in this country for over a long time, but it just went overboard. For some reason, a lot of people they overbled, and there was some theories why they did that. It was like considered to be impure blood, or even some sort of Christian values, where they were trying to take out the blood and hopefully to remove the evil spirits and things like that. But then by over bloodletting, then it got a really bad name, and then nobody wants to anything to do with it. But it isn't that. When we make an incision, so for example, if I make a small prick here on top of the ear, it's amazing for headaches. So I did a talk in front of these physicians, and I was doing this talk, and then obviously had a crowd which wasn't very like a little bit slightly hostile, and it was 200-300 people, and at the end, somebody came to me and she said to me, "Oh, I've got this migraine that just won't go, and is there anything that you can do?" So I says, "Well, I'm not really, I had to take the full case." No. So it was like almost like very difficult situation. So I by chance, I had my equipment with me. I did a small prick here, and her migraine disappeared. And she said she had a migraine for 15 years. She says, I work at the the hospital down the road. I'm a physician, and I'm head of the social department, and my migraine disappeared. So it can be very, very effective. You see, there are other points that we use. More, I tend to use mainly more. It's just getting the insurance through. Balins wouldn't insure me. It was like I had to spend the whole like 3 months with them to convince them that look, it's very similar to hijama. You allowed me to do hijama. It's like hijama, but I have specific points I need to do. So I can't do all the points, but I can only do some points because some points can be a bit more evasive.
Yeah, that sounds excellent.
Yeah.
Thank you.
Well, thank you very much, Shahid, and we look forward to posting this on our YouTube channel.
Great, thank you.
Should we ask him again just to mention how people can contact him and what the
Yes.
URL is?
Good idea.
So just my name, shahidbukhari.co.uk. That's it. And then maybe at the bottom of the YouTube you can put my details, maybe.
Indeed.
And the school, if one wanted to contact the school?
The school is Cutam, so it's cutam.org.uk.
Does that have a special meaning, Cutam?
College of Unani Medicine, as Unani and alternative medicine, something like that.
Oh, okay. Yeah. Great. Thank you.
A good acronym. Thank you very much indeed, Shahid. I will stop the recording.
Thank you for having me.